Good morning, everybody. This tutorial is going to be about Hypericum perforatum, and it's the St. John's wort, which has been used for thousands of years for different types of injuries, and more recently people have used it for kind of emotional depression, which I can talk about a little bit in a minute. But the first idea I want to get across about Hypericum is that this is the primary remedy that we use for nerve pain. And many homeopathic remedies treat specific tissue types, especially for first aid. And so arnica we think about for muscle injuries or joint pain, joint injury, and calendulas for skin problems, cuts and scrapes, things like that, and symphytum for broken bones. So, many remedies treat specific tissue types, and Hypericum is for nerve injury. And probably one of the most common situations is if someone's having some dental work done and there's some drilling of the teeth. If the drill actually hits the nerve, there's a sharp shooting lightning type of pain. And so that's the type of pain that Hypericum will treat. So there's different ways to get nerve injuries. Another one is if the nerve has been stretched or pulled, if the shoulder's been dislocated and the nerves have been traumatized, there can be shooting pains down the arms. Or if there's been an injury in the spine, maybe a car accident or something with sharp shooting pains up into the head or down the arms, then Hypericum will probably be of benefit. And along with the sharp shooting pains, there can be numbness and tingling, or a sensation of paresthesias in the arms or legs. So people that benefit most from this remedy, they've had that type of injury. So I just want to show you a little picture here of what Hypericum looks like. It's got a little yellow flower, and it often grows like on the side of the road or along railway tracks, places like that, and it grows about maybe 12, 18 inches high. And then if you take the flower and you squeeze it, it'll have a little bit of a red resin to it. So that's how you know it's Hypericum. But it can be used pretty safely as a tincture, which means just a 1 in 10 dilution with alcohol. But its greatest benefit is when it's been diluted and made in a pharmacy as a remedy. And the potency we recommend is the 30C. So if you order like a 15 ml 30C strength from a pharmacy, and then take about 15 to 20 drops once a day, depending on the injury. As soon as the pain goes away, you don't have to take it again until the pain starts to return, and then take another dose. And if it returns like 4 or 5 times, and the interval is not getting longer, so maybe the first time you need it after 12 hours, and then you need it after 8 hours, and then you need it after 6 hours. If that space of time is getting shorter and shorter, then you definitely need to get the Hypericum 200C, because it means the injury was really quite severe. And you take the 200C the same way, just when the pain returns. And if the pain keeps returning, maybe you need the 1000 dilution, which is a little unusual, but there are cases out there like that. So the other use for it is puncture wounds, especially if someone maybe the thing they stepped on has the possibility to give an infection. So a puncture wound and a head injury, like severe knock on the head of some kind. Arnica is usually the best remedy, but if it doesn't help, then definitely try Hypericum. And then there are some other head injury remedies that are kind of specialized, but you can definitely try Hypericum. If there's been a surgery and the nerves have been severed or cut, then definitely Hypericum could be of help. And like I said, some kind of dental work where even after the anesthetic wears off, there's considerable pain, then definitely try this remedy. I had a case once where there was an old filling and they had to, it had become infected again and they had to drill it out. And I said, well, I just want to try this Hypericum remedy so you don't have to give me anesthesia. And he said, well, this is a pretty deep filling. We're definitely going to be hitting the nerve. So I said, that's okay. Let me just try it out. So I took a dose of Hypericum before he started the drilling. And then about halfway through, I felt a little spark. So I took another dose. And he continued along and finished up the procedure. And I went home. There was no numbness. There was no pain. So if someone is allergic to anesthesia, or they are a person that's immune to it, like it really doesn't have much effect, and drilling their teeth is a big traumatic experience for them, then definitely Hypericum 30C, maybe a few hours before, and then about 10 hours before. Take it about 10 hours before, 6 to 10 hours before the procedure, and then again about maybe half an hour to 15 minutes before. I'd take another dose and see if that helps. So the last one perhaps is animal bites. Those can be quite painful and lead to infections, so Hypericum and Ledum are both good remedies for that. And then all of our first aid remedies, arnica, Hypericum, calendula, symphytum, bryonia, rustox, all these main first aid remedies are also remedies that can be used for chronic ailments. And so the situation for Hypericum is for someone who's a little bit ADD, they're a little bit kind of intense, the nervous system is kind of working extra hard, overstimulated, and then they become sensitive to light and noise, and it kind of overwhelms them, and later on, after they've been overstimulated for a while, they get kind of down and depressed. So there's the idea of depression again. So this remedy is for depression in someone who previously was very overstimulated and their nervous system started to unravel, and most likely somewhere in there they're going to have complaints where the nerves are experiencing sharp shooting pains or numbness and tingling, along with the chronic ADD or depression that they get much later in life. So the other interesting thing about this remedy is that if it is chronic, sometimes they can develop asthma, which is worse in foggy weather. Or I once had a case of a person with emphysema that was worse in foggy weather. And they also have a strange sensation that when they're sleeping, that they start floating above the bed. So of course they're not floating above the bed, but while they're lying there, they'll start to feel like the body is floating. And if they have that with asthma or emphysema, or with some kind of nerve condition, perhaps even nerve degeneration, so maybe Parkinson's disease or ALS or some kind of other neurological condition, maybe MS or something like that. So if they have that with the floating sensation and they're kind of used to be a very ambitious, busy, kind of overstimulated person that always had to be doing something all the time, and then became irritable from noise and bothered by light, and their nervous system was very on edge, then you've got the whole picture of Hypericum, and that means that person would most likely benefit from taking it once a week for a month or two, and then if it started to not hold or relapse, then you'd move on to the 200. So anyway, it's a very valuable remedy to have in your first aid kit, and I hope by now some of you have started to purchase some remedies and started to use them, because that's, again, the best teacher, the best way to remember a remedy is to use it a few times. So if you only want to start with one remedy, I would start with arnica and just keep it for your family. And every time there's a situation of an injury that causes pain, you can try it out. Anyways, if you want to read more about my remedies, they're in this book here called Homeopathy, Nature's Way to Better Health. And that's available on Amazon. And that's our tutorial for today. Have a good day. Bye for now.